Now we turn you to the coronavirus in Connecticut. New numbers show a drop in the positivity rate and now sits at just over 5%. 69 more people have died, though, since Saturday. And Connecticut's COVID vaccine rollout continues this morning. But Governor Lamont says right now demand far outweighs the supply. Channel 3 Eyewitness News reporter Roger Susanna joins us now live in North Branford to explain why that's a double-edged sword for everyone in our state. So break it down for us, Roger.
Yeah, good morning, Nicole. And it really is kind of a mixed bag, right? On the positive side, it means that our state's vaccine rollout has been pretty efficient on the whole. For example, where we are right now today, Evergreen Walks here in North Branford, they're going to have more doses arriving. I should say Evergreen Woods. Now, that's a retirement community here in North Branford. But the downside is the demand and limited supply means our vaccine timeline likely won't speed up anytime soon. Yesterday, Governor Ned Lamont announced Connecticut is one of just 8 states that have vaccinated more than 2% of the population. Now, most of the recipients, of course, are healthcare workers and people who live in nursing homes. But state leaders say their hands are basically tied by the limited supply right now of the vaccine. Remember that initially, people between the ages of 65 and 74 were supposed to be next in line, but they were all bumped back to phase 1C. Now, that's an indication of how fluid the rollout really is. Governor Lamont says the bottom line is that healthcare workers in our state can only administer doses of the vaccine as quickly as we receive them from the federal government.
What limits us is not our intent to get as many people vaccinated as fast as we can. We've got the platform in place, the infrastructure to do that. What limits us is the supply of vaccines.
We mentioned the doses of the vaccine are going to arrive here at Evergreen Woods in North Branford a little bit later on this morning, and state leaders hope that every Connecticut nursing home resident at least gets their first vaccination by the end of this week. Now, coming up, we're going to talk about why the best chance of possibly moving up the time frame of this vaccine rollout could come at a Zoom meeting later this morning. Reporting live in North Branford, I'm Roger Susanna, Channel 3 Eyewitness News.